Hello, how are you guys doing? My name is Chris A. Matthews, and you are listening to the Marriage Underdogs Radio Show podcast. And yes, once again, we have another phenomenal guest. I would like to introduce you all to Maggie Schell, who is a licensed clinical mental health counselor associate and a certified alcohol and drug counselor. How you doing, Maggie?
I am doing well. Thanks for having me here, Chris. It's
Definitely,
great to be here today.
definitely. And Maggie is a dear friend to the show, as she also is employed by Behavioral Health Intervention Center and Relationship Counseling Group. So Maggie, you have such a phenomenal expertise and a specialty across both the mental health and addiction field. Can you just briefly open up by sharing what led you to want to work with clients that may be struggling with addiction?
Yeah, absolutely. Um, I guess, for a long time, as I was in school, I wasn't sure what path I wanted to go down. And then I was very fortunate to start my internship with Behavioral Health Intervention Center and fell in love with the substance abuse field. And ultimately, it led me down that career path. And um, I love what I do now, and I'm very passionate about the substance abuse field. I do actually have a history in my family with substance abuse, and so that connection as well has inspired me to keep moving forward with helping others, individuals and partners in relationships that do struggle with addiction and helping them as well get through that part of their life.
Yeah, and I'm really glad that you were open and vulnerable enough to share how you have members of your family that have struggled with addiction, because I do as well. In my story, I talk about my father, a lot of other family members, and even myself, who's experimented with substances and have acknowledged that it goes deeper than just a choice. And I'm a firm believer in the medical model that looks at addiction as a disease. For listeners that are unfamiliar with the disease model of addiction, and they might just fault their partner for making a bad choice. Can you talk a little bit more about how addiction goes beyond just a personal choice?
Yeah, absolutely. The first thing I like to think about is it's a very controversial topic, I guess, is addiction a choice, or is it a disease? And so one of the models that, us practitioners essentially like to look at is the ASAM model, which is the 6 dimensions of multidimensional assessment. And so as we follow that ASAM model, it has 6 dimensions to it. And we will walk through those different 6 dimensions, but they really cover, withdrawal potential, what biomedical conditions and complications there are from that patient, emotional, behavioral, and cognitive conditions and complications, the client's readiness to change. There are different parts within that model, and the stages of change inside that model. And then going into dimension 5, relapse, whether there's a potential for continued use or continued problem potential, or even going into dimension 6, really looking at how their social life or their people in their life may impact their future use as well. So there's a lot of dimensions or a lot of key aspects that go into determining their potential risk for relapse when looking at their substance abuse disorders, but also their risk for relapse.
And I'm glad you mentioned the 6 dimensions, because I want to take some time. That's going to really be the bulk of this episode, to help listeners understand. And we're not trying to convince or sell listeners that it is a disease, but I will say, before we go deeper into these dimensions, I use different metaphors when I talk about addiction. One in particular is celiac disease. If you think about celiac disease, it's a indeficiency or a deficiency to gluten, if I'm not mistaken, right? So the body doesn't process gluten the same way in one person as it does another person, right?
Right.
So when you think about alcohol or you think about a drug, there are people who can have a glass of wine once a year at a wedding and never think about alcohol after that.
Absolutely.
Other people that their brain is allergic to alcohol, meaning if they have that one glass of wine, instead of just enjoying the glass of wine, their brain's telling them more, 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 more. And I give that example because how our brain tends to respond to a substance, similar to how our body might react to a particular substance.
Yeah.
I like to share with my clients to essentially take away the blame. You're allergic to alcohol. I will tell a client addiction, you're just allergic to it. You're allergic to alcohol. Your brain has an adverse response that wants more and more and more when you consume it. So when you're allergic to something, it doesn't make you bad. It doesn't make the person that can't have gluten bad because their body processes it differently. So the person who's listening, or if you have a spouse that may be struggling with the addiction to alcohol or substance, they're not bad because their body responds differently to a substance.
Absolutely. And one thing I really like to talk about and emphasize with my clients is that the first time they ever picked up that first drink of alcohol or that first time using a certain substance, their first initial thought wasn't, I'm going to pick up this drug and become an addict. That's not their mind. It's usually in that experimental stage of use, and it's, I'm going to do this for fun. I want to see how it feels. I want to know what others feel when they use it. They don't pick it up and say, today's the day that I'm going to become addicted to this drug. And over time, they become dependent on it. And oftentimes you don't realize you're becoming dependent on this substance. They're experiencing essentially a chemical reaction in their body, which leads to tolerance. And now they're needing more of this substance to get the same desired effect, which they're also not realizing that now they're needing more of this substance to have that same desired effect, which over time leads to this addiction. And unfortunately, addiction is so hard because you don't realize you're addicted to a substance until it's too late. And oftentimes, especially in relationships or with couples and partners, the partner using the substance may not be the one who realizes that they're addicted or that they have the problem.
It could be the supporting spouse.
It could be the supporting spouse who's seeing those differences, like the emotional differences or the physical changes in that spouse, and how maybe suddenly they're reacting or responding to something like an argument, and now they're just being more aggressive, and that's not how typically they would have responded in that same situation before. And that is now the alcohol or the drugs playing.
Starting to make the choice for the person.
Absolutely.
It's almost like there was a picture I saw earlier on in my profession and I also too entered the profession as an addiction counselor. And I recall this picture. It had a guy driving, like he had keys starting the car and he was driving the car, but by the end of the picture, the car was driving him.
Yeah.
And it sounds like that's what you're referring to with substances. The user starts out being in control, but over time, the substance then begins to be in control. So I want to jump into these dimensions because one of the things that we've gotten some feedback from listeners that like the show, we give practical tools, we give practical information for our listeners, right? So we're going to use these 6 dimensions of ASAM to help do that. Dimension 1, acute intoxication and withdrawal potential. So talk to our listeners about what they should do in regards to withdrawal when they have a partner who they suspect that is abusing or overusing or maybe addicted to alcohol or a benzodiazepine. And I'm picking those substances out intentionally, and you can share more on why I picked those substances out too.
Absolutely. So First, those are two of the most difficult substances to withdraw from and the most dangerous substances to withdrawal from quote unquote cold turkey. And so oftentimes those two drugs do need medical intervention. So it's really important as a partner who is seeing the using partner going through this, the level of intoxication or withdrawal potential that is in the relationship, because it's going to directly affect your daily interactions and stability in your relationship.
Right.
You're
And,
and
and, I'm getting that because it sounds like the daily interactions are impacted because the person may consume alcohol when they wake up to counteract delirium tremors or some of the side effects that come when they don't have the substance in their system.
Absolutely. And so when they're experiencing withdrawal, they are going to experience mood changes. They're going to experience maybe even physical changes where now they're a lot more aggressive or angry because they feel this need to have this drug and they can't have it. And especially with those two drugs that you mentioned, it can be lethal if you go cold turkey off of them without medical intervention. And so understanding in the partner's perspective why this dimension is so important, it is really fundamental to ensure your safety in your relationship, but also your partner's safety, because you need to have appropriate medical care lined up if you do choose to go that route of cold turkey, but also understand the importance of seeking out medical care before.
Mm. And that's important because when you hear about a client going into detox, we've heard that detox, and the detox centers are not necessarily treatment. It's really designed to get you ready to go into treatment.
Absolutely.
And to medically detox looks like the client being given a little bit of the substance at a time so their body can transition from having it in their system. So instead of just not consuming alcohol or not consuming a benzodiazepine, the detox center may give smaller dosages. And we look at those two substances because they suppress the central nervous system. And there's a visual I want those that are listening to do, right? Think about having a beach ball. A beach ball full of air. And if you immerse that beach ball underwater and let it go, what's it gonna do? It's gonna pop up above the surface, right? That's essentially what's happening when you let go of using substances. The central nervous system, or like you said, the person's mood, they become angry. So if a partner is becoming angry because they don't have the substance in them, naively, what would the other spouse then suggest they do at that point?
Well, you would hope that they would suggest, they have that medical treatment and they have that support. But unfortunately, the reality is that a partner who is in withdrawal or detox, they're going to be reluctant. They're going to push back. They're not going to understand, or they're not going to want that help. And
And
that
it becomes a dependence, meaning the other spouse may suggest they continue to use.
exactly.
So now they're stuck in this volatile cycle of needing to use in order to counteract the withdrawal symptoms.
Exactly.
And we hear about in our society methadone and Suboxone clinics.
Yep.
And methadone and Suboxone clinics, although they're designed, some centers for pain management, others are strictly in play to be a public health deterrent. Meaning, if you're going and getting your Suboxone and methadone and it's deterring you from using a substance illegally, then you're really just avoiding withdrawal. So you're medically treating the addiction by not having to experience withdrawal.
Exactly.
Now, let's jump to dimension two, biomedical conditions and complications. So this is really an individual's physical and health and their physical health symptoms that are made worse with the usage of alcohol and substances. Can you talk about how alcohol and other substances can damage the body over time?
Yeah, so it's well known that, substance abuse is often a coexisting condition with other medical conditions. And these are going to affect both partners' lives and their overall dynamics in their relationship. And so really in counseling or even just in the relationship dynamic, when addressing these medical conditions, it needs to become part of the conversation and focusing in on how both partners can support one another in managing these health challenges together and being open with each other. So saying, hey, not only is this substance abuse problem going on, but I'm also experiencing this. And right now at this time, we need to talk about this. We need to also go through this together because sometimes we can't just avoid one thing and focus on the other thing if they are coexisting together, because it could make one thing worse if we're only focusing on one thing at a time.
And I'm glad you mentioned that because we've seen through our work, one partner may have a substance use issue that they're relying on to cope with a medical condition.
Absolutely.
So it could be, I have severe pain or arthritis. So they use a substance to attempt to negate the pain, but then that substance use over time now impacts their liver or a major organ.
Yep. And that's a lot of times where we see substance abuse stem from is these underlying conditions not being appropriately treated for, or even insurance denying the ability to get appropriate testing and diagnostics. And so now, unfortunately, doctors are only able to prescribe these pain medications that are addictive. And so over time, these patients are becoming addicted to
the medicine is supposed to help.
Exactly. And so now we're looking at the complications of, well, if I get off this medication, my back pain is going to come back. And so as I'm withdrawing from this medication, now I'm going to start feeling this back pain again. How do I manage this back pain? Because it's unmanageable, but I've been able to subside all of this back pain by using this medicine constantly.
And then that pulls us into dimension three, emotional, behavioral, and cognitive conditions and complications, because we sometimes only think of medication as a physical treatment to pain, but over time we see that clients can rely on that same medication to treat mental and emotional pain as well. And can you talk about how dimension three, emotional, behavioral, and cognitive conditions and complications can exacerbate or make addiction to substances worse?
This is a tricky one because, substances are oftentimes used to cope. And we really, especially as counselors, one of the primary goals when we're working with substance abuse clients is really teaching them how to have alternative coping methods instead of using substances. And so, being able to work with that with our partner too, and relying on our partner saying, hey, this isn't working when coping, because a lot of things are going to come up emotionally, behaviorally, cognitively. And that's crucial when you're in a relationship. And so really
to that point, I'm glad you mentioned helping the partners understand, because drugs work, right? I mean, I don't say that sarcastically, but they work. If a person's using a substance not to feel or not to think about something that was traumatic or hurtful or painful, the drugs work. they do a great job of masking the pain or making you not feel or
Yeah.
giving you the energy you need to get through the workday or to go through a hard time in life. So when you said just now the primary goal of the treatment is to alter the mindset and replace, and there is a grief process, right? When a substance user begins to not use the drug of choice anymore, they're grieving. So
Yeah.
we have to replace what they've used to cope with for time, might be their whole life or most of their life, with something else. So that bleeds into the readiness to change, because not all substance users are ready to find and identify a new coping mechanism. So talk about
Yeah.
what you've identified when assessing a client to determine a low level of readiness to change versus a high level when it comes to having a readiness to change.
Yeah, and so I do, and before because this is going to jump back into the readiness to change, I do want to go back into the emotional and behavioral and cognitive conditions, because there is an activity that I really like to do with my clients, and it's a coping circle activity, and pretty much it's this blank circle worksheet, and it's split up kind of like a piece of pizza that would be cut into these 8 pieces, and you really focus on the quote unquote trigger. So say that I use figuring out why I use, and if that's, I'm using because of my social circle. So, and that's relating back to one of these dimensions the people in my social circle use. So how can I better cope with that? And finding those coping mechanisms that don't involve using substances, but now relating it back to that readiness of change.
Mm.
And saying, am I in this pre-contemplation stage? Because there are several stages of change. Am I in this pre-contemplation stage saying, am I even thinking about changing? Is it even a thought process right now? Am I in the contemplation stage of weighing it out? Like, yes, I kind of want to do this, maybe not. And just going through all of the different stages of change, and
Keep
finally,
going through the stages. Keep
okay.
going.
So let me go back. So we're in the pre-contemplation stage. So the pre-contemplation stage is pretty much when they're not even thinking about it.
Mhm.
And then we're going into the contemplation stage. And this is where they're really weighing out their choices, and determining, like, maybe this is something that I want to do. Yeah, I think I really want to change. I want to figure out what I want to do for my substance abuse, but I'm not quite there yet. Then we're going to get into the preparation stage. This is where they are taking the planning, coming up with ideas and steps that they will take to move forward and
And I like that, and we're going to keep going, but with the preparation stage, when you look at TV shows like Intervention, and when a client's getting ready to go into treatment,
yeah,
there's preparations need to be made. You may need to work with a human resource department at your job and get extended leave time,
yeah,
right? And a lot of people don't know, when you approach your human resource department pertaining to getting medical attention for an addiction, and if you do it responsibly, so responsibly looks like doing it before you fail the drug test.
yeah,
It looks like understanding your short-term and long-term disability benefits.
yeah,
And then if you have insurance, a lot of treatment providers take insurance. So if you're in that preparation phase, looking at what type of treatment will be a good fit for your lifestyle. And then even after treatment, and this is a disclaimer, a lot of people think that you go to inpatient and you come back and you're healed.
right,
Inpatient is part of a longer term process, meaning the inpatient I like to consider as the operation. Well,
Right.
you got an operation, but now you need the physical therapy. You need to learn how to live sober. And that's the relapse prevention. That could be the outpatient treatment. That could be what we consider support groups such as AA, NA, working with a sponsor, 12 steps. But it's a complete package of care and treatment. So if you're listening, you just think you're going to send someone inpatient, they come back fixed or healed. That's a myth for a lot of people treating addiction. The next stage is action. Talk about the action stage of change.
Yeah, and so this is the stage where individuals really are actively modifying that plan that they started to come up with in that preparation stage. And so um this is going to probably require the greatest commitment. They've got to put this plan in action and put the most time and energy. And so this is where now as a counselor you need to provide the tools for your client to be able to make this change and teach them the coping strategies and how
So
to
it looks like
handle
attending the groups if you're the client. It looks like
their.
doing the hard work. It may look like simultaneously doing the one-on-one counseling to process that trauma history that was never dealt with. It may look like identifying new friend groups to be a part of. It's an acceptance stage as well in that action. Doing that work to understand that I'm not a problem, but the addiction itself is a problem.
Yeah, and going back to what you had said about, starting off in detox, that really is stage one for a lot of people, because then you're going to end, you may go into inpatient treatment, but then you may end up into an intensive outpatient and then an outpatient program and then AA and group sessions or group programs. And it's an ongoing treatment. And as we get into that final stage after the action stage of maintenance, maintenance is forever. And maintenance is the most difficult part. Um, and so this is after you've really sustained the actions of going through the long-term treatment and consolidation. And how can we still put all of what we've learned and learned how to cope into action, but for the rest of our lives? And
Right. And that maintenance stage, I think of it like a cancer patient who's working to keep the cancer in remission.
absolutely.
So there's certain cancers that can be brought on by lifestyle.
Absolutely.
There's certain cancers that are just brought on through genetics. Well, for lifestyle changes, if you're working to sustain a relapse prevention plan for addiction, that's all happening every day of your life in the maintenance phase. So my hope is that if you're listening to this episode now and you know someone who has spoken about being sober for X amount of years, or they celebrate their sobriety, that's why they're celebrating the sobriety, because they've accepted that the only way to not have addiction be a problem in their life is to not use it all. And that brings us to dimension 5, and we've already kind of started talking about it: relapse, continued use, or continued problem potential. So talk about how a client can get treatment, but yet still have a high potential for relapse. So what creates a high potential for relapse or for continued use?
And so I'm going to dive into this with that stages of change still. It's so important to realize that even though that quote unquote last stage is maintenance, is that unfortunately the reality is that maintenance doesn't always stay there. Relapse is possible. And so the goal of maintenance is to prevent relapse, but relapse is a very hard and difficult thing to prevent. And so it's okay to relapse. We want to prevent it. But if we have to start the steps over with you again, we're always here to support you. And so that's when we get into dimension 6 is
and when you talk about relapse, there was a saying when I first got in the field, and I'm sure you've heard this too. The saying is relapse is not required, but
Right.
relapse should be expected.
Right.
So it's not required, but as an addiction counselor or someone that works with couples or any mental health providers listening, when your client relapse, we don't require, but there should be an expectation that it's going to take numerous times to get back on that horse of sobriety. And that's why counselors say addiction is one of the hardest things to work with, because there's such an emotional tie to it, right? Like this emotional connection to, I witnessed this client go through a year of treatment and all the hard work. And I witnessed this client rebuild relationships that they destroyed. I witnessed this client get a completely new social group and do all these things. And one drink, boom, they started back over again.
It is. Yeah. And I think a lot of times clients will expect that, hey, I'm now in this maintenance stage and I I'm good. I don't expect to relapse. Like I'm good. I'm like this forever. But it could even be 5, 7, 20 years down the road and something happens and relapse could happen to anybody.
You know, I had a client I was working with and their spouse died abruptly in a car wreck.
Yeah.
And he went back to using substances again. I've had partners who both were in recovery from substances and they lost a child,
Yeah.
or they had fertility issues, they weren't able to get pregnant, or they lost a job. The pandemic was a huge trigger for a lot of people because it created isolation, which could be a trigger. And that bleeds into our sixth dimension, dimension 6, recovery and living environment. Talk about how the living environment, and before you go into it, I always think about when we do our substance abuse assessments, like college kids that live on campus, they automatically have a high rating for Dimension 6 because of recovery and living environment. So talk about how the environment, the potential addict or person that's combating addiction can be impacted by their surrounding.
Yeah. This is a crucial question that we ask our clients when we're doing assessments, substance abuse assessments with them is, how many people in your social setting or social bubble use? And I do sometimes even have to clarify, like, not your best friend that lives in Colorado, hours and hours away that you never see, the people that are really in your daily lives that you're around all the time. And this is so important because if you're trying to recover from alcohol and you're going to holiday parties or you're going to birthday parties or you're just going to watch a football game on a Sunday or do something, and everybody else around you is
Always has substances, right?
always has something like a beer in their hand, and you're trying to remain sober, especially in those early days, it is incredibly hard to resist and say no. And it could be anything. It doesn't even have to be alcohol. If you're trying to come off of a drug, but somebody else is using and still having an altered effect from some sort of substance, but you're completely sober, it's very hard to interact with those people. And so determining how many people are using around you and your risk of relapse because you're not in a sober environment is so important. So when we work with couples, especially, how to create a supportive home environment that's promoting your health for both individuals. Is there alcohol involved?
And on that point, working with couples, I'll see so often one partner may not have any issue with addiction. They can have a glass of wine once a year or every now and again and be okay.
Mm-hmm.
But when you have a partner who you're in a courtship with, dating, or even married, and they have a addiction to substances, and I'll just use alcohol for the example, then you have to make a choice if you're willing to be supportive enough to also be sober too. And couples have to grieve that. I've had a lot of couples, one partner just got upset. He was like, he was in the session and he blew up. He said, I should be able to have one glass of wine with my wife and it not lead to two bottles. And I
Right.
said, absolutely, but that just sounds like the person that said they should be able to have French toast and not lead to a gastric issue and they have
Right.
celiac disease.
Right.
Right? Like, so being mindful that it's not always a choice that you make. It may be the choice that that you were born with based on how your brain responds to the substance.
Well, and using alcohol, especially when maybe even both partners may have a substance use issue with alcohol. So I've got a client who I work with, and both partners have a substance use problem with alcohol, and they're toxic for each other in a way that they both don't want to get the help with each other, and they just blame each other's issues on each other's substance abuse problems. And so they're not taking accountability for their own addiction issues, but saying, no, it's your addiction issue. It's your addiction issue, but not taking accountability in their own addiction issues. And so when there are two people involved that both have substance abuse issues, it becomes a toxic relationship of saying, hey, how can we just finally meet in the middle and say we both need help?
Right, right. And I'm glad that you mentioned as we come to an end how you have situations where both partners are making their addictions worse because they're blaming the other when neither are willing to look in the mirror and acknowledge they have to treat their addiction. Uh, and treating addiction may look like stepping away from a relationship.
Yeah.
And
And
it
that's
goes
hard.
back to being mindful that it's not just one factor. So, and the goal of this interview was to look at these six dimensions. And what we'll do is put a link in the show note where those that are listening will have the opportunity to see these six dimensions, or you can Google ASAM six dimensions to get more insight. Uh, Maggie, this was phenomenal. You've done a great job putting on a master class as it relates to the six dimensions of addiction and breaking these steps down. The goal of the episode, we hope, is that those that have listened will have a better understanding of how addiction is not just a choice. It can go deeper into that. As we close out, what are some final words you want to provide to our audience?
I think it's important to remember, especially as the partner seeing your significant other going through an addiction, is that they will not always ask for help, and it's more than likely that they're not going to ask for help. And it's really important to not always tiptoe around the subject of help, but it is important maybe to approach the topic with care and love, and even seek help in approaching the topic, because it is
Absolutely.
a sensitive situation, um and you don't want to
And
put
couples
yourself
can,
in harm's way.
yeah, and couples can do that in couples counseling, right?
Absolutely.
Like you work with a lot of couples that seek you out because they may not have the skill to talk to their partner about addressing their addiction. So if you're
Absolutely.
listening and you're in the Charlotte metro region and you want to reach out to Maggie, who works with couples that may have issues of addiction, whether it be both spouses or one spouse, do get help, because you don't have to have that conversation with your partner alone. And it may take multiple conversations. It may take
Absolutely.
layers of conversations to get that partner through those stages of change that we talked about earlier. Man, Maggie, once again, phenomenal job. I know this episode will be very helpful for practitioners and clients alike who either work with clients that are or in addiction, or if someone's listening and they themselves or they're in a relationship with someone who is battling addiction. For those that have been tuning in, my name is Chris A. Matthews. We've had opportunity to interview Maggie Schell, who is with Behavior Health Intervention Center and Relationship Counseling Group. Maggie, we got to come on again and do another one. Hopefully, in the future, we can talk about the 11 signs and symptoms as well.
Absolutely. Thank you, Chris, for having me. It's been great. And yeah, I look forward to coming back. Thanks.
Awesome. Thank you. And once again, those that have been tuning in, this is the Marriage Underdogs Radio Show podcast. We drop new episodes every Tuesday on Spotify and Apple Podcasts. We look forward to seeing you or hearing you tuning in to the next episode on Tuesday. Thanks.